In Alzheimer's disease, loss of synapses is a hallmark of the pathology and the best correlate with cognitive decline in Alzheimer's disease patients. Now, a few years ago, it was found that actually synaptic activity can modulate the homeostasis of two main components of Alzheimer's disease, which are the beta amyloid and also the tau, in particular the secretion. And so I was very intrigued by this, and I decided to investigate what happens to these two proteins, in particular tau that I presented in this meeting, when we modulate synaptic activity. In particular, we did it in a setting of deep brain stimulation, which is a surgical procedure used to cure neurological disorders, but also psychiatric disorders. And we could find protective effects. When we stimulate synapses, we see that the pathological tau, in particular the oligomers, that are very toxic species that are soluble and can also spread around to spread the pathology in the brain, are actually degraded. And this was really an interesting result. And so we are investigating. I'm working on this aspect of the pathology. Part of my job, I'm not a neurologist, I'm a biologist, so I'm really looking into the molecular mechanism, the cellular mechanism of protective effect of synaptic stimulation. And we found that when synapses are stimulated, not only the pathological tau levels are reduced, but this involves the mechanism of degrading apparatus, in particular the lysosomes, and this tau degradation requires lysosomal activity. Actually, we found that when synapses are stimulated, when the neurons are activated, the lysosomal system is more active and degrades more efficiently. And we are now investigating all the signaling involved in this kind of action.